Imagine you're supposed to have 32 teeth.
Yeah.
And you're losing like 4. I mean, you can't chew like someone that has 32 teeth, even though, as I said, the wisdom teeth don't really contribute to mastication like the other teeth.
The other ones.
Yeah, so imagine losing 4 teeth that are not wisdom teeth.
Yeah, so Dr. Eddy, please, can you tell us more about what dental implants are?
Dental implants are prostheses that are used to replace a missing tooth or missing teeth, as the case may be.
Okay.
Now, dental implants are, why they are regarded the best is because it's convenience. You don't have to destroy another tooth to put that. You don't have to fix something that you have to put and remove at night, like in the case of dentures. So, it's the best bet to replace a missing tooth.
So you're saying that they are actually permanent?
Yes, they are permanent. We have, as I said, we have dentures. Dentures are the ones you put and remove at night before you go to bed. And this can be a bit inconveniencing, which some people don't really like that. Now, there is also an option of doing a bridge. A bridge, especially when there are 2 surrounding teeth, you can make a bridge, and the other 2 surrounding teeth would be, kind of trimmed. Then a bridge would be made to cover up the space that the tooth was lost. But dental implants, you just have a prosthesis, or as it's called, the implant itself, sunk into the bone, then a crown put on top of it. It replaces the missing tooth at the point of the missing tooth without affecting any other teeth by the sides.
Oh.
And it's permanent. It's expected to last all your life. But as we say, anything God gives us, we can't compare it with the one man makes. Yeah. So, but it's permanent, as I said.
So we can still say dental implants are artificial.
Of course, they're artificial. They are not natural.
Okay, so Doctor, please, can you probably maybe explain a little bit how the procedure is being done?
Okay. Like I said in the previous video, everything done in the dental clinic, if we know it will be painful, we give anesthesia before we go ahead with the procedure. Now, dental implants, before your implantologist puts an implant or sinks an implant, you must have been given an anesthesia around the region, local anesthesia, and in some cases the bone, the soft tissue may be reflected or may be pulled apart. In some cases, you can just sink the implant directly into the bone, the space where you have the tooth. After the implant is being sunk into the bone, a period of time is given, maybe 2 to 3 months, for osseointegration. Osseointegration is just a big word that means the bone to be able to hold on to the implant.
Okay.
Yeah, imagine putting something in the bone, giving it some time for the bone to fuse to the implant and make it, rigid. Exactly. Okay. So after 3 months, a patient comes back for the crown preparation parts, where they will have to, take impressions and send them to the lab, where they will make the implant crowned, and it can just be fixed on the implant. So it's a seamless procedure, and it's the best way of actually replacing a tooth.
Wow. So you mean that if I have a missing tooth, and then I will have to come in and then you sink that implant. So then I'll wait for like 2-3 months for it to get fixed. So what about that process while I was waiting? Like after maybe the local anesthesia wears off, won't I feel pain?
No.
Or
after the procedure, the anesthesia effect takes about 3 to 4 hours. After that, you just take some minor pain relievers, and that sorts it out. The following day, you just come out normal.
Normal.
Yes.
Wow.
It's just that day we always make sure you don't feel any form of pain that day. Some people may come down with swelling 1 or 2 days, same as I talked about in surgical extraction, but it doesn't happen in every. But that does not happen maybe in 80% of cases. Yeah. So that's it.
So, do you think dental implants can help improve our oral health?
Of course. Masticatory efficiency is expected to be, maybe between 70 and 90 or 70 to 100, if that's possible. Now, imagine you're supposed to have 32 teeth.
Yeah.
And you're losing like 4. I mean, you can't chew like someone that has 82 teeth, even though, as I said, the wisdom teeth don't really contribute to mastication like the other teeth.
The other ones.
Yeah, so imagine losing 4 teeth that are not wisdom teeth. Mind you, if you lose a wisdom tooth, we don't replace them because, as I said, they don't really contribute to you chewing. So the only teeth we replace are the teeth aside the wisdom teeth. So if someone loses 4 or 2, even 2 wisdom teeth, the masticatory efficiency cannot be the same as someone that has all the teeth. So definitely, if you lose a tooth, you ought to replace that tooth to help your masticatory efficiency and maintain your oral hygiene generally, because if you lose a tooth, it's difficult to clean the areas behind the tooth that you lost, or maybe a tooth that is standing, the teeth standing around or beside the tooth because you lost the tooth. So that helps to restore how that area is supposed to be and restore function, which is the masticatory function also.
No. So what about people who probably lose like the ones close to the front of the teeth? They don't chew there now.
But I mean, if you lose a front tooth, nobody will tell you. You will look for a dentist as soon as possible, even you don't chew with it. Now, the essence of replacing the tooth in front is for aesthetic purposes and also for biting. You use the front tooth for biting. You use the back tooth for mastication or chewing. When I mean chewing, I mean crushing of the front tooth is used for biting. Now, if you lose a front tooth, an implant can also be placed, and that would restore the function and also help in aesthetics.
Okay.
Someone that has one tooth off, I mean, you understand exactly. You understand how important the teeth is to us. When if you lose a tooth, you know that you look for the nearest dentist to get it fixed one way or the other. And the period of 2-3 months I talked about, there are always temporary crowns that can be used, to put there during the period of waiting, so you don't have to go around or meet people with that, lost tooth. Okay. Yeah, so it can be taken care of. A temporary, crown can be placed there, in the interim,
depending when the
ossification thing has completed, like in 2 to 3 months.
Oh.
So that's it.
Wow, so you can advise anybody out there who probably are missing some set of their teeth or a tooth to invest in getting dental implants done.
Wow, it's one of the best investments to make, because this, you would see it yourself. You get to understand that your chewing would definitely be different, because if you were chewing without your complete teeth, and later on these spaces were replaced by an implant, you understand that chewing it feels different.
Okay, so Dr. Eddy, thank you very much for joining us on the show today. It's actually wonderful to have you around. We would always love to have you around and then to talk about more interesting topics. I don't know if you have any word for our viewers out there, if there's any advice you want to give to them that concerns dental implants or anything you want to say.
Thank you for having me. And I want to tell everyone out there, please, the best time to see your dentist would have been yesterday. The next best time is today. Don't always wait till there is pain or there is a complaint on your teeth before you see the dentist. Visit the dentist. If there's no problems, dentist will tell you that you are good. But if there's any problems, if it's early detected, it's less expensive and less invasive. So it's always best to see your dentist as soon as you can. Thank you.
Okay, thank you. It's a wrap. You got it from a professional himself. And see you soon on our next episode. Thank you.
All right.
That's it.